So, what is Recorlev 150 mg tablet? Well, it is a medication used to treat high levels of a certain hormone called cortisol in people with Cushing syndrome. How does it work? It works by decreasing the amount of cortisol made by the body. Now, let's talk about the benefits of taking this medication. By reducing the amount of cortisol in the body, it can help to alleviate the symptoms of Cushing syndrome, such as weight gain, high blood pressure, and muscle weakness. When it comes to the daily dosage, it is important to follow your doctor's instructions. They will prescribe the appropriate amount for you based on your individual needs. As for the optimal timing, it is best to take this medication at the same time each day to maintain a consistent level in your body. So, if you or someone you know is dealing with Cushing syndrome, Recorlev 150 mg tablet may be a helpful treatment option to consider. Always consult with your healthcare provider before starting or making any changes to your medication regimen. Before you start taking Recorlev 150 mg tablet, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually twice a day. The dosage is based on your medical condition, lab tests, and response to treatment. If you are taking an antacid, take Recorlev 150 mg tablet at least 2 hours before taking the antacid, or it may not be absorbed into the body. Use this medication regularly to get the most benefit from it and take it at the same times each day to help you remember. If your condition does not improve or gets worse, make sure to inform your doctor. If you experience nausea, vomiting, upset stomach, or headache, it's important to let your doctor or pharmacist know. These side effects may occur, but many people using this medication do not have serious side effects. It's crucial to inform your doctor right away if you experience any serious side effects, such as easy bleeding or bruising. There is a small chance that this medication may lower your cortisol levels too much, causing an adrenal gland problem or a decrease in testosterone levels and sperm production. This adrenal gland problem may make it more difficult for your body to respond to physical stress. Before undergoing surgery or emergency treatment, or if you experience a serious illness or injury, make sure to inform your doctor or dentist that you are using this medication. It's important to be aware of any serious side effects, such as unusual tiredness, weakness, dizziness upon standing, diarrhea, weight loss, menstrual period changes, mental/mood changes, such as depression, decreased sexual interest or ability, and enlarged/tender breasts in men. In the case of very serious side effects, such as fast/irregular heartbeat, severe dizziness, fainting, or symptoms of a serious allergic reaction, including rash, itching/swelling, and trouble breathing, seek medical help immediately. Remember that this is not a complete list of possible side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. Levoketoconazole, the main ingredient in Recorlev 150 mg tablet adrenal steroid inhibitors, may rarely cause severe liver problems or affect the heart rhythm. It is important to note that this medication should not be used by individuals with severe liver disease, gallstones, or those who have had previous liver issues caused by azole antifungal drugs. If you experience symptoms such as persistent nausea/vomiting, loss of appetite, stomach pain, yellowing of the eyes/skin, or dark urine, seek medical help immediately. Additionally, levoketoconazole may cause a condition that affects the heart rhythm, which can lead to serious symptoms that require immediate medical attention. It is important to inform your doctor about any medications or products you are taking before starting levoketoconazole treatment. To minimize the risk of these serious side effects, your doctor should order tests such as liver function and EKG before starting this medication and periodically while you are taking it. It is important to follow your doctor's instructions and report any concerning symptoms while taking Recorlev 150 mg tablet. Before taking Recorlev 150 mg tablet, make sure to inform your doctor or pharmacist about any allergies you may have, especially to azole antifungal drugs. Also, let them know about your medical history, especially if you have liver problems, alcohol use, low testosterone levels, or little to no stomach acid production. It's important to be aware that this medication may affect the rhythm of your heart, causing serious symptoms that require immediate medical attention. This risk may be increased if you have certain medical conditions or if you're taking other drugs that may cause QT prolongation. Additionally, low levels of potassium or magnesium in the blood may also increase your risk of QT prolongation. It's crucial to discuss with your doctor about using this medication safely, especially if you have conditions such as severe sweating, diarrhea, or vomiting. It's also important to limit your alcohol intake while taking this medication, as it increases the risk of serious liver problems. Older adults may be more sensitive to the side effects of this drug, especially the risk of QT prolongation. If you are pregnant, talk to your doctor about the risks and benefits of using this medication. It's important to note that this medication passes into breast milk, so it's not recommended to breastfeed while using this drug and for 1 day after stopping treatment. Always consult your doctor before breastfeeding. It's important to be aware of how Recorlev 150 mg tablet adrenal steroid inhibitors can interact with other medications. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Levoketoconazole can interact with many prescription and non-prescription drugs, so it's crucial to inform your doctor or pharmacist of any changes in medications you are taking. Some products that may interact with this drug are other drugs that can cause liver problems, such as acetaminophen. Additionally, other medications can affect the removal of levoketoconazole from your body, which may affect how it works. Examples include HIV protease inhibitors, isoniazid, nevirapine, rifamycins, ritonavir, St. John's wort, drugs used to treat seizures, and many others. It's important to note that levoketoconazole can slow down the removal of many other medications from your body, which may affect how they work. Examples of affected drugs include some benzodiazepines, domperidone, drugs used to treat erectile dysfunction, some statin drugs, and many others. Furthermore, it's crucial to be aware that many drugs besides levoketoconazole may affect the heart rhythm, including bosutinib, disopyramide, methadone, and others. Levoketoconazole requires acid in the stomach to be well absorbed. If you are taking drugs that decrease the amount of stomach acid, ask your doctor or pharmacist for advice on how to reduce or avoid this interaction. Antacids may be taken at least 2 hours after taking levoketoconazole. Lastly, it's important to avoid using medications containing ketoconazole while using levoketoconazole. If you or someone else has taken too much Recorlev 150 mg tablet and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center for assistance. It is important not to share this medication with others. Before starting this medication, it is important to undergo lab and/or medical tests such as EKG, urine/blood cortisol levels, liver function, and blood potassium/magnesium levels. These tests should also be performed while you are taking the medication. It is important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose, just wait until your next scheduled dose. Don't take extra to make up for the missed dose. It's important to store Recorlev 150 mg tablet adrenal steroid inhibitors at room temperature, away from light and moisture. Be sure to keep it out of the bathroom and out of reach of children and pets. When it comes to disposing of this medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this properly. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.